Well, hip osteoarthritis is a degenerative condition of the hip joint. The hip joint's like a ball in the socket, and you have cartilage that sits on the ends of the bones, all bones in our bodies mostly, and then you have a thick cushion in there called the labrum. And the role of the cartilage in the labrum is to take impact, cushion, lubricate the joint, and help with the movement of the joint. And what happens with degenerative hip osteoarthritis is when that cartilage starts to break down, the bone starts to harden, the joint space gets more narrow, and you get these osteophytes, or imagine like cave walls, where it gets a little spiky and rough. And so it's a weight-bearing joint. So when someone has this sort of irritated, inflamed narrowing, it just increases the pressure when they're walking. And so it creates a lot of pain. That pain can be in the front of their hip, the side of their hip, the back of their hip. It can refer pain down the thigh to the knee. And so when you get hip osteoarthritis, it just becomes so limiting that you're unable to exercise, you're unable to do some of the simplest functions. Going out to dinner with your friends would just be a hard thing to do. And there's a whole host of levels, from mild to moderate to severe. And so a lot of people with mild hip osteoarthritis don't even know it. They just think they have a stiff hip, that's just them. And so as it worsens, it'll progress through one's life. And when it gets to a certain point where it's really debilitating, that's usually when somebody will come in and say, hey, I want to see the physical therapist, or go to their doctor. A lot of the times they present with lower back pain, because when the hip stops doing its normal motions, the back will start to compensate and try to do too much. And so we have a lot of people that come into the clinic with back pain, and it's really easy to evaluate them and find out that you have back pain, but you have a hip problem. So oftentimes we'll send them in for radiographs, x-rays to confirm how degenerative their hip is.